Thank you, Dr. Neha. Thank you all. And it's time to start the international session. Today is the 1975th day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, friends of homeopathy, and students of homeopathy. Today is the 1975th day of uninterrupted daily webinar of IFPH. And today our guest is Dr. URMILA BHALGARIYA, Associate Professor and PG Guide, Department of Practice of Medicine, LR Homeopathic Medical College. Dr. URMILA is a physician and researcher at New Life Homeopathic Clinic. And today our topic is rare nosodes, the missing link in difficult homeopathic cases. Let us welcome Dr. URMILA for the session, and I welcome you all for the session. Yes.
Okay, a very warm and respectful welcome to all esteemed seniors, teachers, colleagues, and dear friends from across the globe. I sincerely thank all IFPH for giving me this valuable opportunity to be a part of such a remarkable and uninterrupted journey of daily webinars. Today, I will be sharing my thoughts and clinical experience on the topic Rare Nosodes, the missing link in difficult homeopathic cases. In our day-to-day practice, we all come across cases that remain partially relieved, stuck, or repeatedly relapse despite well-indicated constitutional medicines. Such cases push us to think deeper, beyond routine prescription, and that is where rare and lesser used nosodes may play a decisive role. Through this presentation, I will try to discuss the conceptual basis of rare nosodes, their clinical indications, miasmatic relevance, and a few clinical case-based insights, especially from this perspective of difficult and non-responsive cases. Once again, I express my heartfelt gratitude to IFPH, the organizing team, and all the participants who have joined today from different countries and time zones. With this, let us begin today's session. Thank you. So, what is nosode? The word nosode is derived from the Greek word nosos, meaning disease, and sidos mean appearance. Medicines prepared from nosodes tissue or disease secretions or associated organism, bacteria or viruses in culture from termed as nosodes. So the classification of nosodes, the first is basic nosodes like sorinum, bacillinum, syphilinum, medorinum, and carcinogens. But today we are going to discuss about the rare nosodes, which are exanthem nosodes like morbillinum, parotidinum, vaccinum, pertussinum, diphtherinum, anthracinum, melandrinum, viriolinum, and influenzinum. Next, isopathic nosodes like streptococcinum, pneumococcinum, staphylococcinum, Malaria officinalis, pyrogenum, typhoidinum. Next, autogenous nosodes. It is a secretion or discharges from the pathological tissues or organs of the patient himself used for treatment like totopathy. For example, penicillinum. Next, intestinal nosodes, which given by Edward Bache, which is also known as Bache nosode or bowel nosodes. So there are Bacillus proteus, Bacillus dysenteria coli, Bacillus morgan, Bacillus fecalis, Bacillus mutabile, Bacillus Gardner, and Bacillus number 7. So, on the sphere of action of nosodes, on the basis of symptom totality, the first indications of the nosodes are when the mental, physical generals, and particular symptoms are characteristic of the proving of the remedy. This makes the nosode as a constitutional remedy, in which cases we can prescribe as a constitutional medicine. For example, use of syphilinum in a person who fears the night. Next sphere of action, when indicated medicine fail, most of the stalwart of our system has advocated that when the well-selected medicine fails to act, then think of nosodes or anti-miasmatic medicines to cover the state. Next, partial indication of many medicines. Another way to use a nosode is when partial picture of the constitutional remedy is manifest, yet no one remedy completely fits the cases. Such cases seems to be fragmented and disorganized, but in actually this pattern is characteristic of the MASM and nosodes group. Such an intercurrent often.
Are we sharing the slides or not? To begin, right?
Yes, sir. Not visible. Partial indications of many medicines, like another way to use a nosode is when partial picture of the constitutional remedy manifest, yet no one remedy completely fits the case. Such cases seems to be fragmented and disorganized, but in actuality, this pattern is characteristic of the MASM and nosode group. Such an intercurrent often improve the state of health and regularize the natural symptom pattern after the nosodes has done all it can do. The symptoms will point more clearly toward a constitutional remedy. In this way, a nosode can bring order out of chaos and clarity from confusion. So we can use as a intercurrent medicine or when partial indications of many medicines. Next, when the complaint directly dates from an acute illness in the past, which was either suppressed or did not run its full course, at that time we can also use nosodes. Nosodes are the best choice to begin treatment, particularly in cases when the symptoms are obscure, incomplete, or mixed miasmatic, like anorexia, malaise, and lassitude. So, Hahnemann described the following characteristic of chronic disease, like they are caused by a chronic miasm, or they are small, imperceptible, beginning, and gradually derange the vitality and deviate the living organism. So next, our vital force and immune response are unable to resist them, and there is no normal recovery. They continue to increase gradually, and they end with the death of the patient. So these are the features related to chronic miasm. So at that time, we can use nosode as intercurrent medicine. Next, in the case of one-sided disease, where a patient comes with specific symptoms of a particular disease, but there are no other symptoms at any place, in that case, the nosode of that disease clear up the case or cures it, depending upon the miasmatic symptoms dominating the particular family history. But in such one-sided cases, failures occur more often than success. Next, as the intercurrent, the sixth way of using nosode is when a miasmatic layer obstructs the progress of constitutional remedy. That was improving the patient. When a nosode is used like this, it is called the miasmatic intercurrent. It is said that in a psoric case, when sulfur fails to act, think of sorinum. In psychotic cases, when thuja fails, think to medorinum. Next, as a genus epidemicus or as a genus disease, this is the seventh way for using a nosode is when the remedy is related to the genus disease. For example, Clark use of pertussin against whooping cough. So Clark once wrote, I have found in this nosode a specific for a large proportion of cases of this disease. Next, as a prophylaxis, the eighth way of using a nosode is as a homeopathic prophylaxis to prevent specific acute and chronic infectious disease. An early example of this was Bonninghausen's successful use of verulinum to prevent smallpox as a prophylaxis. So, nosodes may also be used as a method to protect children from the miasms they have inherited through their parents. So J.T. Kent has been quoted in his lecture on homeopathic materia medica as saying, if tuberculinum bovinum be given in 10 m, 50 m, cm potencies, two doses of each potency at long intervals, all children and young people who have inherited tuberculosis may be immune from their inheritance and their resiliency will be restored. Next is the autonosodes. This is the ninth way of using nosode is a homeopathic remedy made from the patient's own disease substances. This is an autonosode. This has sometimes helped patients when nothing else seems to work. Hahnemann's had a patient who was not responding to his well-chosen remedies. This led him to prepare a tubercular autonosode made from the saliva of patient who was suffering from tuberculosis. So autonosodes have been made from sputum, blood, urine, pus, leukorrhea, exudates from skin eruptions, and microbes from culture of the patient. These tried when nothing else worked. Any other conditions when we can use nosodes, like fear of any specific disease? Many times nosodes cure the fear of specific disease such as tuberculinum in the case of tuberculosis, carcinosin in the case of cancer, and so on, and fear related tuberculosis and cancer. Next is a pathological prescription in incurable disease. Nosodes may be used either as a palliative or to prevent spread and complications. For example, carcinosis is administered to prevent growth and spread in patients suspected of or in early stages of malignancy. Next, as a complementary medicine, nosode have proved to be better complementaries along with traditional ones when prescribed on concordance relationship. Like Dr. Kasim recall a case of acute urinary tract infection in 6-year-old girl who responded only to repeated doses of Bicole 30C followed by Apis mellifica 200 when Apis alone was not satisfactory. So we can use as a complementary medicine. Next, as a second prescription, it has been observed that many times symptom pictures of relevant basic nosodes like sorinum, syphilinum, and others come up after the similimum has worked. They are given to complete cure. For example, tuberculinum or syphilinum after Calcarea carp or Calcarea fos. Next, if they are marked mental symptoms of nosodes are present, like other medicines of our materia medica, the mental symptoms of nosodes are also well marked. In that condition, whatever may be the name of the disease, the patient is suffering from, the patient must improve by administration of that medicine. If the vitality of the patient is not very much run down, if the patient is unable to withstand the reaction of the vital force, the patient may succumb to death as witnessed in various cases. Next, to wind up the treatment of any chronic case, after the constitutional treatment is over, to prevent obstinate relapses. In this content, Dr. Dubey says it can hardly be seen in our practice that a chronic miasmatic case is permanently relieved or cured without the prescription of nosode during the course of treatments. So without taking the help of nosode, complete recovery of chronic case is hardly possible. So these are the indications of nosodes which already we have discussed, like as a constitutional remedy, when well-chosen remedy do not act, when lack of symptoms are present, when never well-seen syndrome, patient has never recovered fully after miasmatic infection, and next, when a partial picture of constitutional remedy, when no single remedy fits the case completely. Next, as a miasmatic intercurrent, and next related to genus disease, and as a homeopathic prophylaxis, and as a autonosode remedy from the patient's own disease substance. Where not to use nosodes if the vitality of the patient is too low to strain the secondary action of the vital force. We must not use nosodes in centesimal scale of potency, but we can use medicine in LM potency sometimes, or sometimes as a higher potency if required. Many authority has forbidden us from prescribing tuberculinum in an active case of tuberculosis or carcinosin in an active case of cancer, so on. But we think based on our practical experience, if there is a prescribing symptoms or symptoms of those nosodes, then we must prescribe tuberculinum in active case of tuberculosis or carcinosin in active cases of cancer, and so on. And in general, we get good result, either palliative or cure is the case in hand demand. 50 millisimal scale of potency at times with beneficial effect too. So contradiction of nosodes. never in active phase, avoid during incubation period of acute disease, never in explosive stage of miasm when symptoms are eruptive or aggressive, never used during active phase of recurrent attack, especially in relapsing conditions, and never used in infectious stage. For example, do not use tuberculinum in an established case of tuberculosis. So these are the well-proved nosodes like tuberculinum, soranum, medoranum, syphilinum, and pyrogen, which we are using in day-to-day practice. But these are the rare nosodes or rarely proved like influenzinum, leuciticum, pneumococcin, streptococcin, staphylococin, typhoidinum, parotidinum, scarlatinum, eosinophilinum, and typhoidinum. So common indications of nosodes, constantly changing symptoms. Second, developmental problem of organ or system. Next, lack of reactions. Next, block in the case after indicated remedy fails. When teeth deformities are present, and when hereditary illness in family like eczema in the family which are present. Why rare nosodes matter today? So clinically, we have used rare nosode in resistant cases, often plateau with classical nosodes. Rare nosodes expand therapeutic horizons when chronic lifestyle diseases are present, when resistant infections are present, when complex autoimmune diseases are present. So rare nosode act as a keys to unlock stuck cases and stimulate new healing responses. So chronic and resistant cases often do not respond to classical nosodes like tuberculinum, syphilinum, medorinum, and carcinosin. When we have required rare nosodes like scirinum in the case of cancer where we can use carcinosin when family history of cancer is present, but when scirinum is required, there is no family history of cancer, but patient come with the cancer conditions, and if history of worm infestation, then we can use scirinum. Next, anthracinum, malaria officinalis, pyrogenum provide a new therapeutic avenue by addressing overlooked miasmatic layers. They help break stuck cases where patients plateau or relapse despite repeated constitutional prescriptions, increasing prevalence in modern times due to emerging disease and resistant infections and complex chronic conditions. Nosodes as a tools for resistance cases. So we can use as an intercurrent used between constitutional remedies, resetting the case for deeper actions, for the case transformation. For example, soranum or pyrogenum, like soranum unlocking sulfur response and pyrogenum in septic state. Key principle in prescribing rare nosodes, like when miasmatic background are present, like nosodes tried to measure miasm, like psoriasis, psychosis, syphilis, and tuberculosis and cancer, and rare nosode addressed submiasms like malaria officinalis and scirinum. Clinical indications like chronic relapsing and resistance cases are present when constitutional medicine does not act, when strongly family history is present like cancer, TB, and syphilis, and post-infectious sequel. At that time, we can use the nosodes. And remedy relationship like nosodes complement constitutional remedies, can precede or follow classical remedies. For example, soranum follows sulfur or lycopodium. So already we have discussed this point. So first we are starting with the exanthem nosode. These are derived from infectious exanthematous disease source like crust or of illness or secretions from disease like measles, mumps, and influenza. So first is diphtherinum, prepared from trituration of diphtheric membrane or dilution of diphtheria toxin. Keynotes of diphtheria indicated in diphtheria and laryngeal diphtheria, especially when the disease appears malignant from the beginning. Post-diphtheric paralysis, especially affecting the soft palate and limbs. Severe prostration with very offensive breath and nasal discharge. thick dark diphtheric membrane in throat or nose, swollen glands, red and swollen tongue, swallowing without pain, but fluid may be vomited or expelled through the nose, epistaxis and toxic bronchitis, especially in elderly or post-influenza cases. Clinical use, acute diphtheria, especially with systemic toxicity, post-infectious paralysis, especially after diphtheria, toxic bronchitis include vasoparalytic bronchitis in elderly patient, and scrofulous and catarrhal respiratory tendencies. For a case example, a child with post-diphtheric paralysis of soft palate unable to speak or swallow properly, given diphtherinum 200, improvement in speech and swallowing within days. Differentials of diphtherinum like Merck cyanatum, in which we can see rapidly spreading diphtheritic membrane, high fever and ulceration. Calimure, in which white or gray membrane present, less toxic appearance and chronic glandular involvement. Next, diphtherinum specific nosodes for diphtheria with systemic toxicity and paralysis, like complications of diphtheria or any new disease conditions arise after diphtheria. Next, influenzinum prepared from inactivated influenza virus or vaccine. So key features: post-influenza weakness, neuralgia, chronic fatigue, preventive in epidemics. Case example, we can see 45-year-old teacher, lingering fatigue after influenza, prescription influenzinum 30, which restored energy. And differentials, for example, we can see gelsemium, in which post-viral weakness, but in influenzinum is specific nosodes for influenza sequels. Next, morbillinum prepared from buccopharyngeal secretions of untreated measles patients. Keynotes: chronic bronchitis, asthma after measles, weakness and lingering cough, remedy for measles terrain and its complications. Fever, catarrh, coplic spores, macular rashes spreading downward, bronchitic rash and photophobia on otitis. Also, morbillinum act in acute measles, post-measles sequels, and tubercular predisposition. Clinical use in post-measles complication and respiratory weakness. Case examples: a boy with chronic asthma after measles given morbillinum 200 and asthma improved. A differential in brownia, we can see cough after measles, but in morbillinum is specific nosode for measles sequels, and miasm, which covered covered acute epidemic. Parotidinum prepared from inactivated mumps virus or disease parotid gland tissue. Keynotes indicated in complications of mumps, orchitis, ophoritis, mastitis, and pancreatitis, useful in recurrent parotitis and glandular swellings, fever with painful swelling of parotid glands, dry mouth, difficult swallowing, earache, and jaw stiffness, preventive and therapeutic in mumps and its sequence. Clinically, we can use in mumps and post-mumps complications, especially affecting glands and reproductive organs. Case example, a teenager with painful testicular swelling after post-mumps given parotidinum 200 and pain and swelling reduced significantly. In differential, we can see belladonna in acute inflammation with high fever, rustox for the glandular swelling with stiffness, and parotidinum is specific nosodes for mumps-related conditions. So these cover also acute conditions or acute epidemics. We can use as a therapeutic medicine. Vaccinum prepared from the lymph of smallpox, especially vaccinia virus, and nosodes prepared from vaccine matter like smallpox or other viral vaccines. Keynotes useful in ailments from following vaccination. After vaccination, produce fever, skin eruptions, and neurological symptoms. Also indicated in vaccine reactions, suppressed eruptions and chronic fatigue post-vaccination, headache, malaise, chills, and skin sensitivity after immunization. Also act on vaccine miasm and post-vaccinal syndrome, clinically used in post-vaccination complication, vaccine-induced disorders, and detoxification support. In case example, we can see a child with eczema flare up after routine vaccination, give vaccinum 200, skin symptoms subside gradually. In differential, we can see thuja for after vaccination or chronic effect of vaccination, cilicia which expel foreign matter, we can use also after vaccination, bad effect or vaccination, and in vaccinum, it is a specific nosode for vaccine related disturbance. So miasm, which covered artificial disease or artificial heterogenic miasm. Pertussinum, prepared from the sputum of patient with whooping cough. Key features like sequel of whooping cough, chronic spasmodic cough, and nervous irritability. In case example, we can say 6-year-old child, chronic spasmodic cough, month after pertussis. We can prescribe pertussinum 200 and cough relieved. In differentials, we can see Drosera for spasmodic cough, but pertussinum is a post-pertussis nosode. Next, anthracinum, prepared from anthrax virus material, potentized for in homeopathic against septic and malignant conditions. Keynotes of anthracinum like malignant carbuncles, septic conditions, rapid tissue destruction, gangrene. Main keynote is offensive discharge and burning pains. Clinically, we can use in septicemia, malignant ulcer, and carbuncles. In case example, we can see a farmer with malignant carbuncle and offensive discharge give anthracinum 200, infection control and healing started. In differential, we can see arsenic for burning pains and offensive discharges. And anthracinum is specific nosode for anthrax-like septic state. In miasm, we can see it covered destructive tendency, so syphilitic miasm. Next, melandrinum, prepared from decomposed, purulent, or scaby discharge from the heels of horse suffering from equine pastern dermatitis, commonly known as grease or melandra disease, a chronic skin condition in horse. In keynote, we can see sequel of vaccination, especially after smallpox vaccination. After that, patient have chronic skin eruption, eczema after vaccination, general weakness and fatigue. In clinical use, we can use in post-vaccination complication, especially after vaccination, there is present of chronic eczema or history of eczema. In case example, we can see a child develop eczema after smallpox vaccination, give melandrinum 200 and eruption subside. In differential, we can see thuja for bad effect of vaccination and history of warts or present of warts. In melandrinum, it is a specific nosode for post-vaccination eczema. Miasm, which is artificial or iatrogenic. Variolinum, it is prepared from purified potentized pustular material or lymph taken from or made from the lymph of smallpox pustules. In keynotes, we can see sequel of smallpox, preventive in smallpox epidemics, and pustular eruptions and scarring. In clinical use, we can use in post-smallpox complications and as a prophylaxis. In case, we can see a man with chronic skin eruption after smallpox given variolinum 200 and eruptions are subsided. In differential, we can see antim-tart for pustular eruptions and variolinum. Variolinum is specific nosode for smallpox sequel. And the miasm, which is covered, this is acute conditions. So we can see differentiation between vaccinum, variolinum, and melandrinum. So vaccinum for vaccine effect, and it is produce artificial miasm. Variolinum for smallpox, and as a acute conditions, and melandrinum for malignant skin conditions or chronic eruptions, and that is cover bad effect of vaccine. And vaccinum used after vaccine troubles, variolinum for smallpox bad effect, and melandrinum for chronic skin conditions and masm related it. Next, isopathic nosodes. These are made from the same agent like bacteria, viruses, or disease tissues used to treat the same illness they originated from. Source specific pathogens like streptococcus, pneumococcus, or toxins. So first, that is streptococcinum, prepared from the nosode of streptococcus bacteria. Streptococcinum, pathophysiologically, it is used for rheumatic cardiac conditions or endocrine involvement, chronic inflammation, menstrual irregularity, and pelvic pain. In psychic effect, we can see irritability, hypersensitivity, and clear chronic streptococcal immune sensitization, reduce inflammation, and support ovarian uterine tissue recovery. Clinically, we can use in chronic pelvic inflammatory disease, fibroid with immune component, and resistant menstrual disorders. So we can use in PID patient of female. So keynotes related it like indicated in streptococcal infection, sore throat, tonsillitis, otitis media, and septicemia, high fever, red swollen throat, offensive discharges, glandular enlargement, also useful in recurrent streptococcal infection and post-streptococcal complications and autoimmune sequels. Clinically used in septic state and post-infectious complication. As a case example, we can see a child with recurrent tonsillitis and fever given streptococcinum 200, and frequency and severity of episode reduced after prescription. In differentials, we can see belladonna as a acute inflammation with high fever, heparsulf for supportive tonsillitis, and streptococcinum is specific nosode for streptococcal terrain and sequel. So miasm, it is covered septic conditions and destructive state. Pneumococcinum, it is prepared from the bacteria of Diplococcus. It is found in 50% cases in the saliva of healthy persons, in the nasal mucosa and mucosa of pharynx and conjunctiva. In this, we can see depressive conditions with pain of which the seats may be on any part of the cervicodorsal region, plus respiratory troubles, mainly of bronchitis, plus palpitation, plus dysmenorrhea with delayed menses and premenstrual syndrome. Clinically, like depressive conditions with anxiety desire to remain at home, horror of going out, great feeling of being ill, and death sensation of some liquid in head when bending down, frequent headache in the nape of neck, aggravated by noise. Keynotes: nosode of streptococcus pneumonia or pneumococcus indicated in pneumonia, pleurisy, bronchopneumonia, septicemia, sudden high fever, chill, rusty sputum, chest pain, and dyspnea. Also useful in recurrent pneumonic attack and post-pneumonia weakness, act on respiratory terrain with septic tendency. Clinically, we can use an acute pneumonia, pleurisy, septic state, and post-pneumonia complications. In case, we can see an elderly patient with recurrent pneumonia and lingering weakness, given pneumococcinum 200, recovery improved and relapses reduced. In differentials, we can see brownia for pleuritic pain and dry cough, phosphorus for respiratory weakness, and hemoptysis with degenerative conditions. In pneumococcinum, we can see it is nosode for pneumococcal infection or relapses. So miasm, it is covered destructive tendency and septic tendency. Next, staphylococcinum, prepared from Staphylococcus microorganism capable of producing bacterial endotoxin. In keynote, we can see indicated in staphylococcal infections like boils, abscess, carbuncles, septicemia, recurrent pustular eruptions, offensive discharges, slow healing wounds, and act on supportive conditions, chronic staphylococcal terrain, and septic state. In clinical use, we can use in boils, abscesses, furunculosis, septicemia, and chronic staphylococcal infections. For in case example, we can see a patient with recurrent boils and slow healing abscesses gives staphylococcinum 200 and frequency of boils reduced and healing improved. In differential, we can see heparsal for suppurative tendency and painful abscess, cilicia for expel pus and chronic suppuration. In staphylococcinum, it is a specific nosode for staphylococcal septic states. So it is also covered destructive and septic tendency. Malaria officinalis. It is prepared in a badly defined nosode. Dr. Brand conceived the practicability of testing the effect of artificial toxin prepared from a pit or decayed vegetable matter or decomposed vegetable matter taken from a marsh area during dry season when the malaria toxin was most active. Now, in modern era, it is derived from P. falciparum parasites. A badly defined nosode, already we have discussed. So, in this, we can see a sensation of general weakness, paleness, plus occipital headache with vertigo and nausea, plus trouble sleep with sensation of rolling as if on valves, plus weak respiration with hawking explosive cough, plus frequent bloody morning diarrhea, liver and spleen painful, plus fever, coldness, then heat and abundant perspiration, plus sensation of dryness in the mouth with pasty, humid saliva. In keynote, we can see indicated in chronic malaria state, intermittent fever, enlarged spleen, anemia, periodicity of fever, chill, heat, and sweat stages are present, weakness, headache, neuralgia with digestive disturbance, also act on chronic malarial terrain or post-malarial complications. Clinically, we can use in intermittent fever, chronic malaria, in splenomegaly, anemia, and post-malaria debility. In case we can see a patient with recurrent fever every third day, enlarged spleen and weakness, given malaria on nosode 200 and fever periodicity reduced and strength improved. In differential, we can see China for debility and anemia after malaria, Natromure for chronic intermittent fevers with splenomegaly. In malaria nosode, it is specific for malarial periodic fever and sequels. So it is cover periodicity and relapses. In pyrogen, it is derived from decaying and toxic animal tissue. In keynote, we can see septic state, high fever with rapid pulse, offensive discharges, foul odor, restlessness, and delirium. Clinically, we can use in septicemia, puerperal fever, and post-surgical infections and fever after surgery. In case example, we can see a woman with puerperal fever, foul discharges, and rapid pulses given pyrogenum 200 and fever subsided and recovery began. In differentials, we can see arsenic alb in which we can see restlessness and offensive discharges. In pyrogenum, it is specific nosode for septic fevers. So it is also covers septic state. In typhoidinum, it is prepared from endotoxin of Salmonella typhi bacteria. In keynote, we can see sequel of typhoid fever, chronic debility, digestive weakness, nervous irritability, and low vitality. In clinically, we can use post-typhoid weakness, chronic digestive complaint after typhoid fever. In case example, we can see a man with chronic weakness after typhoid fever given typhoidinum 200 and strength gradually restored. In differential, we can see China for debility after fevers, and in typhoidinum, it is specific nosode for typhoid sequels. So it is also cover acute phase. Autogenous nosodes. These are individualized nosodes made from the patient's over pathological secretions from the pathological tissues. Source like discharges from the patient like pus, urine, sputum, blood. So it is known as the totopathy. For example, penicillinum from penicillin sensitive cultures and totopathic nosode from drug residues. So in penicillinum, prepared from the penicillinum notatum mold or from penicillin residue, purposed used in totopathy to counteract ill effect of antibiotic overuse, hypersensitivity, and microbial imbalance. Keynotes indicated in drug allergies, hypersensitivity, and ailments from antibiotic abuse, useful in recurrent infections where antibiotics have failed or caused side effect. Symptoms are present like digestive disturbance, skin eruptions, weakness, low vitality after repeated antibiotic use, act on drug mechanism or artificial disease, and post-antibiotic terrain disorders. In clinically, we can use an antibiotic hypersensitivity, recurrent infection, chronic weakness after prolonged penicillin use. In case example, we can see a patient with chronic diarrhea and skin rash after repeated penicillin courses or any antibiotic courses. Give penicillinum 200, symptoms improved and vitality restored. In differentials, we can see sulfur for skin eruptions and drug reactions, nux vomica for digestive upset from drugs. Penicillinum is specific nosode for penicillin-related ailments, and masm which covered artificial disease or drug-induced disease. Next and last, that are the intestinal nosodes. Intestinal nosodes prepared by Dr. Bech and Dr. Wheeler from the bovine flora. And source is non-lactose fermenting bacilli from intestinal flora. So first, that is Bacillus proteus, prepared from inactivated non-lactose fermenting proteus bacteria isolated from stool and potentized after sterilization. Constitutional indications: patients prone to sudden crisis rather than slow chronic deterioration, high sensitivity, excitability with abrupt symptom onset. Often considered when there is a family history of nervous disorders or autoimmune tendencies. So key indications for this nosode is mainly indicated in sudden violent nervous system disturbance and autoimmune conditions and certain acute inflammatory state or acute exacerbation. Its keynote is brainstorm, abrupt, intense mental or neurological symptoms are present. Clinical association indicated in autoimmune and inflammatory conditions. In case example, we can see a 28-year-old woman with migraines, irritability, and autoimmune thyroiditis. She has a high strung temperature, react strongly to stress, and has alternating constipation and diarrhea. Proteus is linked to autoimmune tendencies, emotional volatility, alternating bowel habits. So it suits patient with sudden shift in mood and energy. Differentials: Proteus has autoimmune link and sudden shift. In nux vomica, it is more predictable in irritability, and in Lycopodium has insecurity, and sulfur has philosophical history. Keynotes of Proteus indicated in neurological disorders, epilepsy, chorea, and behavioral disturbance, sudden violent symptoms, spasm, convulsions, and restlessness, act on nervous system, especially in unstable or erratic conditions, and associated with intestinal dysbiosis and auto intoxications. So clinically, it is used for the epilepsy, chorea, behavioral disorders, intestinal toxemia, and neurological sequels. In case example, a child with recurrent convulsion and erratic behavior given Proteus 200 and frequency of seizures reduced and behavior stabilized. So in differentials, We can also see like cupromet for convulsion and spasm, Alzheimer's for behavioral disturbance and mania. And in Proteus, it is a specific nosode for neurological instability linked to intestinal terrain. So it is also covered destructive tendency. Next, Bacillus dysentery coli, prepared from the culture of dysenteric stool and potent as per. Constitutional indications: patient with a history of repeated dysentery or chronic bowel infections, weak constitutions with poor resistance to infections, children with recurrent diarrhea, malnutrition, and irritability, adult with long-standing digestive complaint resistant to well-selected remedies. So key indications are recurrent fever with digestive origin, chronic fatigue linked to poor assimilation of nutrients, headache and migraine associated with bowel disturbance, skin eruptions like eczema and urticaria when linked to gut dysfunction. In clinical association, digestive disorders and tension state, in case we can see a 35-year-old man with chronic colitis, frequent mucus stools, and anxiety about health report a history of dysentery in childhood. This nosode is indicated in post-dysenteric syndromes, mucosal inflammation, and hypochondriacal tendencies. It helps restore gut flora balance. Differentials, we can say dysentery coli is chronic sequel of dysentery. Mercor is for acute bloody dysentery. Podophyllum is for gushing diarrhea, and arsenic is for burning restlessness. In keynote, we can see it is indicated in chronic colitis, dysentery, diarrhea, irritable bowel syndrome, frequent loose stool, mucus, blood, abdominal pain, tenesmus, also act on chronic intestinal strain and especially post-dysentery weakness, and also useful in recurrent bowel disturbance and malabsorption state. So clinically, it is used in chronic dysentery, colitis, irritable bowel syndrome, and post-infectious intestinal weakness. In case example, we can see a patient with recurrent diarrhea and mucus in stool after past dysentery, given dysentery code 200 and bowel frequency reduced and strength improved. In differential, we have seen Mercor for bloody stools and tenesmus, Podophyllum for profuse watery diarrhea, and in dysentery co, it is a specific nosode for chronic dysenteric strain, and it is also cover septic phase. In Bacillus morgan, it is prepared by subtype of Peterson, prepared from a P. morgan gram-negative bacteria stool culture. Morgan nosode is indicated in advanced chronic cases where intestinal toxemia forms the maintaining cause and constitutional remedies fail due to impaired vitality and absorption. Morgan clear bowel sepsis and improving vitality, especially when digestive imbalance, block constitutional action, and when skin gut alteration are present. For example, diabetes plus constipation, PCOS plus IBS, obesity with chronic bloating. In case we can see chronic IBS from 10 to 20 years, long-term constipation with periodic diarrhea, chronic dyspepsia with systemic complaints, and multiple diseases starting after prolonged gut issues. Next case, we can say 55-year-old male, rheumatoid arthritis since 12 years and constipation every 3 to 4 days with flatulence and distension with depression. In past, they taken NSAIDs and they also present of recurrent acidity. In analysis, we can see advanced autoimmune gut origin, low vitality. In prescription, we have give Morgan 30 one dose, and in result, better stool in 10 days, joint pain reduced slightly and energy improved, followed by constitutional calcarea carb. So in Morgan, we can see congestion, cutaneous, pulmonary, hepatic, intestinal, cerebral, etc. Patients often appear blooming but suffer repeated congestive state. terrain like psychotic, congestive, reactive, remedy for congestive conditions and repeated organ and mucus related conditions, congestive headache, hepatic origin and articular swelling, corrosive leukorrhea and eczema of baby, act in chronic psychotic conditions with congestion, eruption and depressive state. In clinical association, it is also given in gallbladder and mucosal inflammation. In case a 42-year-old woman with gallbladder dysfunction, flatulence, and skin eruption, she is critical, restless, and has a history of suppressed anger. Morgan suits patient with biliary issue, skin gut axis disturbance, and emotional suppression. It's often used in eczema with digestive complaint. So keynotes, it is also indicated in chronic skin conditions like eczema, psoriasis, acne, and urticaria, digestive disturbance, constipation alternating with diarrhea, flatulence, colitis with emotional irritability, depression, and nervous tension. Clinically, it is used in chronic skin eruption, digestive disturbance, irritable bowel syndrome, and psychosomatic complaint linked to gut imbalance. In case, we can see a patient with chronic eczema alternating bowel disturbance given Morgan 200, skin improved, bowel symptoms stabilized. In differentials, we can see sorinum for dirty, offensive skin eruption and chronic weakness, sulfur in itching, burning eruption, and digestive upset. Morgan is a specific nosode for skin gut axis disturbance, so it is cover chronic relapsing conditions. Next, Bacillus fecalis, prepared from Fecalis bacillus stool flora and potentized it clinically. In clinical association used in chronic gut imbalance, in case we can see a 50-year-old man with chronic fatigue, low immunity, and frequent colds. He is a passive personality, avoid confrontation, and has poor digestion. Fecalis is for low vitality, poor assimilation, and recurrent infection. It supports immune modulation and gut restoration. In differential, Fecalis is immune modulator plus gut imbalance. In Calcarea carb is chili and fat. In Sorinum, it is hopeless, dirty appearance. In Cilicia, it is delicate with poor assimilation. So in Fecalis, we can see stool finding linked to sepia-like state. In Fecalis, there is a gut nosode with foul stool and septic terrain. And in sepia, it is a polycrest remedy with gut, skin, female axis involvement with offensive discharges. So overlap, both are for chronic intestinal toxicity with offensive discharges and systemic weakness. So in keynote, we can say intestinal complaint, chronic intestinal disorders, dysbiosis, constipation, diarrhea and malabsorption, foul smelling, abdominal distension and flatulence, irregular bowel habits, and act as a septic and toxic complaint. In clinical conditions, we can use in chronic colitis, irritable bowel syndrome, dysbiosis, and post-infectious bowel weakness. In case example, we can see a patient with alternating constipation and diarrhea, offensive stools, and chronic fatigue given Fecalis 200 and bowel rhythm improved, offensive odor reduced. So in differential, we can see dysentery for bloody mucus stool with tenesmus. In Morgan, skin gut axis disturbance with eczema with bowel issues. And in Fecalis, it is specific nosodes for septic intestinal terrain with foul discharge. So it is also covered destructive tendency. And Bacillus mutabile derived from unstable flora given in albuminuria, in morbid metastasis with alternating skin eruption and asthma, alternating diarrhea and constipation, in digestive disorder, skin eruption that appear and disappear suddenly or shift in character, respiratory symptoms alternating with digestive or skin complaint. So it is specifically for alternating complaint like asthma alternating with eczema, migraine or headache alternating with digestive upset. In keynote, alternating symptoms and shifting pathology. So it is also associated with pulsatilla kind of state. In clinical association, it is also used in variable digestive symptoms. So in case we can see a 22-year-old student with IBS, mood swings, and difficult adapting to change. So there is a clear pattern. So mutable is ideal for variable symptoms, emotional instability, and adaptation issues. It helps stabilize gut-brain axis dysfunctions.
Sorry
In
to interfere.
differential,
Excuse
yes,
me.
sir.
Interfere, and very few minutes more to go to conclude. We only have 3 more minutes, sir, doctor.
Yes, sir.
3 more minutes to conclude because the time is.
Okay, sir.
Yeah.
Okay. Mutable is gut-centered variability. Ignatia is emotional contradiction, and pulsatilla is mild and changeable, and lachesis is intense, left-sided, and loquacious. So we can see alternating kind of personality in this kind of nosodes. Next, Bacillus Gardner, specific for malnutrition, chronic digestive disorder, malnutrition, and condition arising from the poor assimilation of food. It is also prescribed in children with failure to thrive and recurrent diarrhea and nutritional deficiency. Clinical association we can see in wasting disease, poor growth, nocturnal fear in children, and indigestion of fat. Clinically, we can use in tubercular condition, hypothyroidism, sexual weakness, and chronic rheumatism. Differentials like calicarb, calcarea floor, calcarea carb, rustox, and causticum. So Gardner is enteric wasting. Tuberculinum is for restless tubercular diathesis. Phosphorus is for bleeding weakness, and China is for debility from fluid loss. Next and last, Bacillus number 7, prepared from stool isolates, mental and physical fatigue with poor assimilation and low vitality. So Bacillus number 7 is practically indicated in case of mental and physical fatigue with poor concentration, low vitality, and past illness debility, especially when linked to digestive weakness and assimilation problem. Clinically, we can prescribe in fatigue, toxicity, and low-grade inflammation. So this is prescribed for systemic toxicity, detox support, and inflammatory syndrome. It is useful in chronic fatigue syndrome and fibromyalgia. So how to differentiate? Like carcinosinum is perfectionist, cancer miasm, sorinum is hopeless fatigue, and sulfur is for systemic burning toxicity. So guideline for prescribing in acute stage, we can starting from the 30. In chronic exacerbation, we can use in hypotensive, but we can start with the 200. And in chronic phases, chronic advanced phases, we can use in lowest potency, but repetition form. In mental cases, we have to give in very high potency like 50 cm, but single dose. Thank you.
Thank you, doctor. It's an excellent presentation, a synoptic view we got regarding the nosodes, the importance. When well selected, it will prove wonders. And for us an intercurrent for befitting cases without any results, we can also employ this. So it was an excellent session. On behalf of IFPH, I thank you, doctor. And please come again with more interesting topics. We always welcome you, doctor. It was so interesting, and it's time to conclude. Otherwise, we might have some interaction with the attendees also. And so the time is nearing to conclude. I thank again profusely on behalf of IFPH, and I thank you all who attended this webinar. Tomorrow we will meet again by 8:30 Indian time. Till then, bye. And over to Malayalam.
Thank you so much, sir.